how have you seen technology be implemented to kind of deal with that patient education side of this entire journey? Are you seeing any effective ways technology is being used, or are there any implementations that you hope to see in the future?
Yeah, I think one of the biggest things that we started to do and really started to push was the idea that a patient owns their own medical record. All the information contained therein actually is about you as a patient, so it makes sense that the patient has access to it. I think the conversations that are happening about healthcare with patients should obviously include the patient, but not only the patient, but also their family. And I think, although we are starting to pay a lot more attention about getting that information to the patient, we need to include the entire family unit into that discussion because they have a lot of influence into actually what happens. One big example is actually with tobacco use. If I counsel a patient about their own tobacco use, and let's say that they stop, but their partner still smokes, their rates of kind of going back into their old habit actually goes up exponentially because of that. And also the idea of secondhand smoke and third-hand smoke, those things are only addressed in a family system. They cannot be addressed just one-on-one. So any technology that includes the family dynamic, I think that's the next step in information sharing and technology to accomplish that goal.
And do you find that, the doctor's visits are so short and it seems like there's so much information to get through? Do you find that there's enough time to get through that information? Or when you look at the lifespan or the relationship of information sharing and conversation, what do you hope to see as far as creating space for more in-depth conversation, or what's missing there?
Yes and no. I think there's both not enough time and a lot of time at the same, junction. And what I mean by that is, yes, your visit with your physician might be 5 to 7 minutes or so, but we have an entire care team, and to be able to involve that entire care team into something like prenatal appointments is something that I look forward to seeing more of. One of the It's not even a large innovation, it's something that we know works, and that's called centering in pregnancy. And I don't know if you're familiar with that concept, but really truly it means that we do group classes with our patients. Everybody who is of a certain gestational age, they'll get around into a group, they'll have an opportunity to ask questions of an expert on that topic. So let's say that we're talking about something like domestic violence. So we might have a domestic violence advocate or expert give a talk about that topic. And you'd be very surprised. Maybe you wouldn't even be surprised about it, but the act of one person asking a question often prompts a lot more questions that people might not even know that they had. And so then you get a much more enriched environment where you're able to glean more from that discussion. We need to do more of that, obviously. But even outside of the concept of centering in pregnancy, employing people like doulas in those prenatal appointments, or certified nurse midwives in those prenatal appointments, or even the medical assistant, empowering them to have more directed and focused conversations with the patient. That's how we actually enhance healthcare. It doesn't have to center around the physician, although I know we like to think we're the center of the universe. It doesn't have to be like that, and it shouldn't actually be like that. It's a true health team that's taking care of a patient.
Speaking of this conversation about doulas, just basically anyone assisting with birth that's not a physician, people are either on one extreme or the other. And I feel like there are a bunch of maybe misconceptions about what that process is like. What are some of the most common misconceptions that you hear regarding, birth being facilitated or assisted by a non-physician, and how do you maybe navigate that? What are some of the systems that people might not know about that exist for certification training, and how might a person like that work hand in hand with a physician to ensure a safe delivery?
I think there's a very large gap in knowledge with the providers when it comes to, I don't want to call them ancillary staff, but people who are assisting in the birthing process. One of the biggest misconceptions is that either the doula doesn't know what they're talking about, or they're going to get in the way of my plan as a practitioner for this particular patient. Saying things like they'll just try to convince you out of a cesarean section, even though we know that the cesarean section is necessary. That's one of the largest things that I see among my own colleagues when it comes to doulas. But the reality is much different than that. I think obviously getting to know the support staff is something that as practitioners we don't do enough of. We need to understand their background. We need to understand their certifications, things that they're comfortable with, things that they might not be comfortable with, because it is a practice of healthcare. And I would be remiss if I were to suggest to you or anybody else that I know everything. I clearly do not. I don't think anybody knows everything. We can all learn from each other and our shared experiences. And every single day that we go into a patient interaction or even an interaction between providers, the goal should be to actually learn and understand and improve our outcomes day by day.